Children with diabetes. Diabetes occurs in individuals of any age. More than 13,000 kids in the United States have type 1 diabetes. It is among the most common long-term diseases in school-age children. Obesity, lack of exercise and unhealthy eating habits are primarily the causes of the condition among children. Type 2 diabetes is not a common occurrence among school kids. In just over 20 years, incident rates among kids and teenagers have almost tripled. The causes among kids with type 1 diabetes. This described by the inability of the body to produce insulin. The condition was previously known as juvenile diabetes, since it is primarily found among young kids, although the problem is presently known to happen among adults too. Genetic factors can also influence the possibility of a child getting diabetes mellitus. A person with a close relative like a sibling or parent with diabetes is more likely to get the disease. Environmental factors can also be the cause of the rise of early symptoms. 2. Symptoms of diabetes. Children with diabetes can present a number of symptoms. These include increase in thirst, headache, behavioral problems, sudden weight loss, fatigue, complaints about abdominal pain and frequent urination. The presence of ketoacidosis can also point out diabetes among kids. It is a very serious problem wherein acids, known as ketones, are discovered in the urine because of the utilization of the body of fats instead of the usual carbohydrates. 3. On insulin. A number of children having diabetes require insulin. During the initial phases of diagnosis, these kids may also require small doses of fast-acting and slow-acting insulin, which boost with age. The advent of insulin pumps for administration has allowed several kids to have flexibility on a day-to-day basis. The time of administration, dosage and frequency of injections all rely on the child's age, blood glucose level and activity. 4. On blood sugar levels. It is important to balance blood sugar level to control diabetes, since low or high sugar levels can display health risks, particularly for kids who still belong in the growing phase. It is important that the child and the parent watch the blood sugar levels every day and adjust the exercise, dosage and meals accordingly. The diabetic diet is quite similar to the food pyramid guide. However, patients need to consume less fats, especially fats that come from animals, and sugars. They should also boost the intake of fruits, vegetables and fibers. Parents do not need to cook separate meals for the diabetic child, since the whole family can consume the diet. Skipping meals is not advised since you may experience dangerous effects. 5. Exercise and drugs. Physical activity is a vital aspect of diabetes, since it lowers blood glucose levels. Even though exercise is good, the sugar level should also not go down too deep. Always consult your doctor about the exercise and diet program to suit the special needs of the child. For type 2 diabetes, there are medications that help adjust the body's resistance to insulin. Watch your carbohydrate and fat intake very closely.